Okay. Welcome, everyone, to this first installation of the Institute for Liberal Values, Critical Social Justice in American Institutions, a challenge to liberal values. This first live stream episode is Critical Social Justice in Psychotherapy. And we have got a great panel with us here. We've got Valerie coming in right there. So she should be on in a minute. There we go. We have got Dr. Sally Satel, who is the resident scholar at AEI and a staff psychiatrist at a local methadone clinic in DC, a prolific writer who has been looking recently at when woke therapists become activists. I think I got that right, Sally? That might not have been the exact title, but we have Valerie Tarico with us, who is a psychologist and a writer in Seattle, Washington. She also has been doing a lot of community organizing and writing around the woke imposition within psychotherapy. And finally, last but not least, we have Zander Keg, who is an award-winning social worker, and he has working on this issue and sees this issue every day in practice. He's a first-generation American of a Mexican heritage and a post-transition transsexual man and a former Coast Guard veteran. We also have as our moderator Lee Jussum, who is a distinguished professor and chair in the psychology department at Rutgers University. And we will be moderating along with him David Bernstein. He's the founder of the Jewish Institute for Liberal Values and the co-founder of the Institute of Liberal Values for Liberal Values, along with myself, Jennifer Richmond, also a co-founder of the Institute for Liberal Values and the Hold My Drink podcast. And before we get started here, one of the things that we really wanted to do, because we feel a lot of times these conversations devolve because we really don't have a working definition for what we're talking about, and we use terminology different. So when we're talking about woke ideology, what it really means in the terms of this conversation, and particularly around psychotherapy and mental health, is it's groups. Woke ideology tends to group people into oppressor and oppressed camps based largely on external characteristics that diminish the role of the individual and individual agency. So with that, no further ado, what we're going to do is let each of our speakers give us a little bit of an introduction on who they are and their work, and then we'll get into a conversation. So Sally, why don't we start with you?
Sure. Well, I've actually been interested in the intrusion of what used to be called political correctness into the medical and psychiatric sphere since for 21 years, and seemed to go underground for a while. In fact, the first time I became aware of it was 1995, when I heard and had confirmed that San Francisco General Hospital had divided up its inpatient units by race, so that if you were an African-American person with schizophrenia or depression, you would go to it was called the Black Focus Unit. If you were Hispanic, they had a one for gay individuals at the time, women, but none for white men. They go wherever there was a bed open. But, it was a very, very startling development. The implication was, as stated by the psychiatrists who developed this arrangement, was that basically only individuals who shared the same identity group / ethnic group could understand these patients, and the patients would feel infinitely more comfortable relating to people who were like them in that way. Now, on an individual basis, that could well be true, but as a universal pronouncement, there's no evidence for it. And in fact, as I understood, what happened was actually the treatment often devolved into a near exclusive focus on the person's identity group and how that individual was, how his or her symptoms, even to the extent that people were psychotic, which we know is the origins of those conditions are rarely socially sort of socially created. I mean, they can be certainly worsened by stress, but you don't become schizophrenic because you're a victim of racism. But that's how everything devolved into this understanding that people's symptomatology was actually an expression of their being victimized. And this was in 1995. I followed that through something called multicultural counseling, which was actually the first textbook in that came out in the 80s. And I'll just quote the key line from that, which is an instruction by the author for white counselors, quote, to ask themselves this: as a member of the white group, what responsibility do you hold for the racist, oppressist manner by which you personally and professionally deal with minorities? I mean, these two things together really represent the most destructive elements of what we might call woke therapy. One is that it's an assault on the primacy of the individual. The person is subsumed into the identity of the group, and that practitioners themselves really should become activists. So it changes both the nature, in a way, the nature of therapy. It's an imposition of a victim narrative without knowing anything about the person, which is, of course, counter to any competent caring therapy. The patient defines the problem, and it also is a change in the mission and the identity of the professional, which is to prioritize activism. And these are very destructive to the therapeutic enterprise, as we'll discuss. I just want to I know we don't have much time for our little talks here, so let me just get in one other manifestation of this. I was giving a talk last year at a major university, and I talked about drug addiction. And I was criticized for daring to talk about the dimension of personal agency in addiction. The nature of the criticism was that, in fact, this was a white population, but it was an impoverished one. And the nature of the criticism was that I was insufficiently sensitive to the fact that these folks were, I mean, this was in the context of the opioid epidemic, that their use of drugs was responsive to, a very, very depressing environment without much sense of a future, with a lot of economic devastation and family unraveling. And I did mention all that, of course, but the idea that I'd get such a hostile response because I did not emphasize that, rather I emphasized the agency of the people, because that, as therapists, that's what we work with. We take that fragment, that remnant of agency that's left, and try to help the patient breathe air into it. That's what we do. We don't treat them as victims. So I'll just close by saying this is a very pernicious philosophy that's very much codified in the counseling profession. And I worry that it's going to migrate more and more into my field, which is psychiatry. Thank you.
And Valerie, let's look at you and your work recently. You've written a lot on the impact of this ideology on psychology. So give us a little overview of who you are and what you've been doing.
Thank you, Jen. I'm a psychologist by training, a counseling psychologist, although I'm retired from clinical practice because I spent most of the last decade working on what one might describe as progressive infrastructure, think tank capacity, youth civic engagement, voter file technology, et cetera, kind of working to kind of orchestrate and build those things on the left half of the political spectrum, because I perceive that to be a more leveraged form of engaging in social change and improving people's lives. But it has become clear to me that some of these dynamics around wokeism not only are playing out in the political sphere in sometimes consequential and counterproductive ways, but that the culture or kind of habits of thought and relationship that have grown up around this also, to a large degree, counter much of what we know from research into healthy human functioning, from research into kind of in the development of evidence-based therapies like cognitive behavioral therapy or dialectical behavior therapy. And that what we are doing is, kind of, if some people have, used the term anti-fragile to some degree, what's happening is we are seeing a pattern of what might be called harm inflation, or cultivating fragility, cultivating a kind of a sense of the self as a wounded being that may have some utility in an advocacy sphere, but that at an individual level and an interpersonal level is harmful. So I recently wrote an article for a group called Critical Therapy Antidote, which was founded by a British psychotherapist and hosts information and resources for psychotherapists, whether they're psychiatrists, social workers, psychologists, or master's level counselors, but folks who are concerned that the infusion of and even ascendancy of this kind of activist approach is counterproductive for their patients and clients. And I want to just cite 4 different examples of ways in which the kind of thinking that is endemic in wokeness as an approach to social justice, or critical social justice, if you want to call it that. There are many different kinds of approaches to social justice, and the one that is ascendant now that we are talking about is just one of many. But this particular approach runs counter to what we know about effective psychotherapy and effective healthy human functioning in 4 specific ways. So one is the ascendancy of emotional reasoning, that if you feel something, then it is true, that especially a person who is perceived to come from an oppressor tribe in no way is allowed to question an I feel statement as kind of being a representation of reality for somebody who is who is higher up on the oppression index, if you will. And that's counter to what we do as psychotherapists, because quite often what we're trying to do in evidence-based therapy is to get people to be able to distance from the emotional reasoning, to be able to see that my emotions are one part of myself. They are we need to take them seriously. But there are many times that our emotions are exaggerated or distorted, that they reflect something that is a part of my own history rather than my present situation, that they reflect something that's part of our ancestral history rather than our present situation. And being able to use cognition, reasoning, kind of those kinds of capacities to evaluate how veridical our emotional reasoning is really important part of healing and then maintaining psychological health. The second one is is the kind of idea of identity. So as Sally said, you can think of identity as being a part of 3 buckets, or falling into 3 buckets. There is the unique individual, there is our shared humanity, and then there is the tribe. I remember one of my clients saying, in some ways I am like all people, in some ways I am like some people, in some ways I am like no other person. And so when we are working through psychotherapy, typically what we're trying to do is to elevate the individual identity, to see that they do not have to kind of play out the stories that were a part of their family history, that they can choose to have intentional path in life, intentional families, and to kind of shake loose some of the things that would otherwise bind them. By contrast, this critical approach to psychotherapy basically labels people as kind of average representatives of their tribe, and makes the assumption that they have had this kind of tribal experience that really distances them from their unique individualism and shared humanity. So the third part, and again, Sally touched on this, is the idea of agency, that we, in advocacy work, people are often focused on what we psychologists would call external locus of control. So the idea that something is happening to a person, that there are systemic issues, for example, or that are kind of impinging on the individual and making it impossible for them to flourish. And that the idea is, I think appropriately, that when you're involved in political activism, you want to look at what you can do to change systems and processes and structures in society. But when you're kind of focused on the individual in a psychotherapy relationship, what you want to focus on is internal locus of control. Kind of what are the things that are within that person's ability to shape and change? What are the pieces of what's happening to them that they are maybe inadvertently bringing upon themselves because of our tendency to play out old patterns, things that were adaptive or maladaptive for ourselves as children, or for our parents, or for even ancestors who came before. And then the fourth piece that I called out in the article I wrote for Critical Therapy Antidote, Why Your Woke Therapist May Be Doing You More Harm Than Good, is the idea that in relationships, you can take a breaking or a bridging approach to relationships, right? So a breaking approach is what you would take when you're in a divorce process with a lawyer, and you kind of soldiered up, and you're trying to figure out how you can extract yourself from a relationship, or beat the other person, or get the most out of it at their expense, on the assumption that you are not going to need to relate to them intimately, or in fact in any constructive or collaborative way in the future. But within psychotherapy, mostly what we are trying to do is to cultivate bridging relationships. And I would argue that often in society at large, we need more of that as well. But the idea is that rather than kind of treating family therapy or individual therapy as if the person was headed into family court, divorce court, that what we want to do is be kind of figuring out how to have more constructive relationships. And that means going into situations, starting out with the best possible assumption of what the other person is trying to say, or with their intent, and not treating wounds as if they were inflicted by aggression. And if you look at what's going on in critical social justice theory and practice, the idea that every wound is a, quote, micro or macro aggression, for example, it really changes the definition of aggression. And then what it does is it empowers or sanctifies the idea that if somebody has aggressed against you, then you can punch up against them, and that doesn't even need to be proportional, all of which runs very counter to what we think of as best practices in psychotherapy and best practices in human relationships. I'll stop there.
Zander, you're on the ground as an active social worker. Let us know how this is affecting you in the work that you do.
Absolutely. Thank you, Jen. It's an honor and privilege to be on the panel with my esteemed colleagues. Well, a little bit like Valerie, I left my psychotherapy practice. So I've been working as a different kind of social worker, more in the consulting capacity since July of 2020. But I'm still affiliated, of course, with professional associations and doing social work of a different kind. And what I can say is this, that I went to college in the 1990s as a non-traditional student. I was in my 30s. I had come out of the military. And that's when I first encountered this idea of political correctness. And it was being introduced into most of my humanities-based courses. And so I was sort of, as part of LGBT community, I was seeing how that was impacting our community and out in the world, and the ways in which we were trying to utilize that criticism of the way in which broader society or general society, non-gay people, so to speak, were treating LGBT people, were viewing us, right? So I remember a lot of those dynamics from back then. In the social work profession, where I saw this coming up was right around 2016 or 17. I think it was 2017. One of the social work professional associations created an online portal for members of the association to communicate with each other. And questions were posed, and people would answer those questions. And so many, many different topics came up. But I can tell you right now that two topics in particular created the most combustion on that list. One was, can you be a Christian and a social worker? Somebody asked the question, and it blew up. It was probably one of the longest threads that had been on that portal since it started, with a lot of people saying, no, absolutely not, which I find interesting, because would they ask the question, can you be Jewish and a social worker? Can you be Muslim and a social worker, Hindu and a social worker? But asking, can you be a Christian and a social worker? It's like, well, what about all of the churches that have these great social service programs? What about Christian or Protestant related universities with MSW and BSW training programs or education departments? So it seemed a little ridiculous to me as a trans man seminary graduate that you couldn't be a Christian and a social worker. Another question that blew up pretty in a large way was, can you be a conservative and a social worker? And of course, it was the same, very explosive responses mostly people saying absolutely not. And in both cases, what people narrowed in on was if you're a Christian and or if you are a conservative, a member of the Republican Party in particular, and a social worker, you were by default violating the social work code of ethics. Somehow. Right. Where'd I go?
You violated the social work code of ethics.
All right. Sorry, my video went away. Yeah, that you were just
Zander.
Yeah, see
by
what
default.
happens?
By default, right? You were violating the code of ethics. And of course, there were a number of us, there were 2 or 3 of us in particular, that took on the challenge. And because somebody asked the question, what within the code of ethics appeals to a conservative? I don't consider myself a conservative. I'm more, of a moderate libertarian leaning person, but some people took on this challenge and they went through the code of ethics and they started putting into this thread, here are all of the social work values and ethics that I, stand behind, I believe in, I utilize in my work with people that I'm working with. And I don't think we're ready for that kind of response. And so it just evolved. It was getting pretty toxic. I personally decided to exit from that chat board, and I haven't been back since. Some of my colleagues have remained in the fights, and it is a fight. It hasn't let up. All these years late, I mean, it's, we're what? A year and a couple of months since the election, and they're still going on and on about Trump and Trump supporters in this. I mean, and as social workers, right, our goal is to meet people where they are. We're meeting with people in a lot of cases as a homeless outreach social worker with the VA. What I was doing, I was working with anybody who walked in the door. I couldn't ask them, what's your political affiliation? Who did you vote for? Right? I had to work with people in psychotherapy, with veterans and military families. That was not an issue. We worked with people based on what we're bringing them into the session. And so this idea that people are going to treat people differently in a session based on their political affiliation, or people would complain about, oh, my client came in with a MAGA hat today. And it's like, so what? Right? Like, just do what you want, work with this client for at their level, what they want, what their goals are. So, some of the ways that it's impacted me directly. Oh boy. Well, there's a licensed therapist in California that has decided to take aim at me over the last several years, trying to get me canceled from events and different projects that I've been involved in by labeling me a racist, a transphobe, telling people that I've committed violence against the trans community. There's, of course, this is not true, but they say it anyway, and people who don't know me will take them at their word, because why would they make that up? Another way that it's impacted me is I was the chair for about maybe half a year of a committee for a national transgender organization, medical, healthcare focused organization. And I affiliated myself with a trans organization that somehow became associated with more, I wouldn't call them conservative, but less orthodox views on transgender health, let's put it that way. And so my affiliation with that organization branded me a person that was no longer eligible to be the chair of that National Advocacy Committee for Transgender Healthcare. I mean, I still to this day don't know exactly what I did and what evidence they used to determine that, because the person who was in charge of that organization, who was part of the decision-making body, has refused to speak with me. So there's no transparency whatsoever. There's no grievance process. There's no appeal process. I was just removed, and I just have to basically suck it up. So the cancel culture is alive and well in the trans community. And I'm definitely living proof of that. I keep doing what I'm doing. I'm having a good time doing the work that I'm doing, and I'll continue to do the work that I'm doing as a trans person, as a social worker, as an advocate in the community, especially doing these types of formats by speaking out about what's happening. And there's a lot of other things I can talk about, but I'll wait for the questions to come.
Well,
So I just want to step. Can I step in? I just want to
Yeah.
make a comment. I have a comment, and then I do have a question. Actually, Zander, your story there, like, you practically re-presented the opening paragraph to a blog I have on 10 ways to tell if you are targeted for cancellation. So I just want to read this because it's just too much fun. You're being denounced by a mob and subject to vile accusations. You are besieged. You may be accused of being a racist, transphobic, or a traitor. You may be accused of causing, quote, harm, of traumatizing people, of denying people's existence, or similarly ridiculous and histrionic charges. Their accusations are mostly or completely false, but social reality can take on a life of its own. If enough people repeat it, it must be true. So that's just the opening, and it's like, there it is, in the flesh. But I have a question that I'd like to throw out to all of you. It's one thing to argue that critical social justice, woke perspective has overtaken many professional organizations and institutions, especially in the helping fields, whether it's medicine or psychiatry or psychology, and in the academy. I mean, there's just abundant evidence for that. But that's a different issue than whether people impose that view in practice. So, for example, I'm going to give you a parallel example. It may well be that the New York Times is overrun by woke staffers and reporters. There are people who will make that claim. But that doesn't mean they're reporting about the Russian quasi-invasion of Ukraine is true or false. That reporting may be dead on target. In the same way, whether a therapist is conservative or liberal has never been a particular problem in the past in the actual conduct of therapy. In fact, several of you made a point very much like that. And so isn't it possible that no matter how woke the professions become, it's not actually affecting the practice of therapy very much? And that's just a very different consequence of what you might call a woke takeover than people suffering personal personal ostracism and attacks and denunciation as part of their involvement with these organizations. So those are different things. And I wonder, the question is, how much do you know, how much experience do you have, how much information do you have about the extent to which this perspective actually taints or undercuts the validity or quality of therapy?
Should I? I'll go first. Well, that's actually my biggest question. I'm interested in this in medicine overall. And I always think when the door closes, is a doctor not going to talk to a diabetic patient about watching his or her diet and exercising and taking medication, all the things that would recruit the person's participation? I don't know. I'd love to know that as well. But in the case of, and I specify counseling, I think we do know that it really is infiltrating. The website that Val mentioned, Critical Therapy Antidote, is just full of first-person accounts, most of them anonymous, understandably, by people who have been trainees of counseling programs and taught this malign form of therapy and expected to implement it, and patients who've been on the receiving end. So that's pretty compelling. Plus, for anyone out there who's a counselor, in fact, all of us I joined. There's a new group called the International Association of Psychology and Counseling, and it was started this summer by a former, I think, 2-time president of the American Counseling Association to pretty much create a parallel organization that things had got evidence things have gotten so bad. And the second thing I would say is, even if it's not making let's say it's not making its way, which is not true, it is, but okay, is what are the training programs displacing in order to teach their theory? I mean, that's the day you're not going to learn about cognitive behavioral therapy. That's the day you're not going to learn about how to think about the whole group of anxiety disorders and, how could that distinguish PTSD from, various general anxiety disorder and all those kind of things. What are we missing and displacing? And how is education being corrupted in that way?
I would add that I think right now there is there's a generational kind of cascade here because of the impact and the infiltration into training programs. So what you have right now is a broad array of people in the field still who were trained before these concepts became ascendant, and who were grounded in evidence-based therapies, grounded in the scientific method, which now some of these more woke people say is a white male way of knowing, grounded in aggregated data, which now some folks say should take a back seat to lived experience. And I feel strongly that in psychotherapy, it's the patient's job. They know best what their lived experience has been, and it's our job as a therapist to bring in some of the broader information about what is known about flourishing. But so right now, a savvy seeker of psychotherapy services, if they kind of knew what questions to ask, could absolutely find somebody who is not going to be taking this kind of activist approach to psychotherapy. What I worry about is people coming up, in 5-10 years, because it's so pervasive now as I understand it, in psychotherapy training programs. I was working with a kind of center-left Black psychology student on some issues that I was providing coaching on, and just listening to how incredibly uncomfortable it was for him as a Black man, even to be able to challenge some of the ideas that were being kind of just spouted as if they were common knowledge. There wasn't room for discussion. It was just like, this is the way things are in his peer group when they had discussions during classroom exercises.
Yeah, it's within social work, there have been attempts at the various schools, of course, around the country to introduce more of these woke ideas into the studies. But it's going to be in 2025 more codified, because the Council on Social Work Education has put out some new guidance, and they're the accrediting body for the schools of social work. And so they have determined that by 2025, these schools of social work are supposed to be implementing a lot of these ideas into the training programs for these social workers in training. Another thing, Nina in the comments section put in a quotation from 2013 from an NASW newsletter, and this is the kind of sentiment that was coming up on the. I think she's just giving us an example of what was the kinds of things that were coming up on this communication board that I was speaking about earlier. And what's interesting is that social justice is one of several philosophical, ethical values of the profession of social work. Right? It's not to be prioritized over, for example, service or integrity or the dignity and worth of the person. Right? There are a multitude of ethical principles that we're guided by, and so elevating social justice to somehow being social workers are social justice workers, I think, is what is happening in the trainings, and also in a lot of the workplaces that are starting to implement some of these policies in environments where social workers are working, like Department of Child and Welfare and aging services, homeless services. So it's definitely impacting the social work profession at many different levels.
Okay, so what? Oh, sorry. There we go. So, this is painting. I'm wondering how grim the picture is. Like, I'm prone to grimness myself, actually. So don't treat I was probably going to sound more skeptical than I mean to, but the grim view, and this would include the mental health professions, but really any professional organization that spends its time doing other things than getting good at what it's supposed to do. So if on Twitter just the other day, there was, I think, a German physicist who claimed she got her grant rejected because she didn't explain whatever her physics study was going to be, what it did to advance gender diversity. Now, you could make the case that if that's that kind of thing is a screening tool, and at least one of the California schools, I don't remember whether it's UCLA or Berkeley, is now using DEI statements as a screening tool for faculty hires. So you have to first make the cut, as having an acceptable DEI statement before you move on to the phase of like consideration of the quality of your work. Then the argument would go that, well, now you're no longer selecting the best applicants, at least best if defined as being good at the field that they're applying in. The woke version would be that, being able to articulate the reasons to advocate for diversity, equity, and inclusion, whether it's in physics or astronomy or chemistry or anything else, that is part of what makes a candidate good. But obviously it's a completely separate issue than whether you're good as a chemical scientist. And so if you're using criteria irrelevant to the skill set, to the accomplishments in the profession. Now, in our case, we're talking mental health professions. Then what you would predict is an overall decline in the quality of that work, and the quality of therapy, and the quality of physics as a science. But on the at the same time, authoritarian regimes such as the Soviet Union, came up with the atomic bomb like a year after the United States did. So whether it's science or mental health, how grim is the prospect for the future, even in the worst case scenario where social work becomes woke, psychology becomes woke, psychiatry, it all becomes woke. What happens?
So I will say, I'll jump in here and say that I think one of the problems here, first of all, you could raise the question of like how relevant the social sciences are generally, I guess, right? And how much we're going to shape society or mental health practices specifically. But I think one of the problems here is that this woke approach, some folks perceive that intersectionality is kind of a way of taking a more granular approach to kind of the idea of the variety of human lived experience. But I would argue that, in fact, in some ways, it constrains us and oversimplifies our sense of what's real and kind of how people are made up. So increasingly, we know more and more about psychobiology, and Sally can speak to this better than I can, but that, so we are going to be able to more precisely tailor interventions around an individual's specific kinds of trauma, around their specific kinds of family trajectory, and around eventually the psychobiology of how different people's bodies respond differently to medications, for example. And this blurs or erases those distinctions by focusing in on the individual. And if it was just some folks focusing on this kind of woke taxonomy, that might be okay, but it's got such a strong moral taboo associated with it that it actually taints people who are wanting to focus on some of these other kinds of questions.
Yeah. Lee, I think, we'll probably have our answer at some about the extent to which this poison is seeped in, because frankly, no one will want to see a therapist anymore, because this whole kind of approach is completely undermines the Therapeutic Alliance. I mean, you cannot have a relationship with a patient if you walk in with, a script telling them how they fit into a morality, a cultural morality play. You can't empathize with the guy who wears the MAGA hat. It's full of judgmentalism. It's everything a therapist is not supposed to be. In fact, as both Valerie and Zander know, I mean, you have to pay someone to be your supervisor when you're a therapist. You have to pay a wise old, woman or man who's been around forever and talk to them about your own, countertransference to the patient, how you're reacting to them in ways that you think you could either learn something from, because that's often information in that, but also how it may be clouding your judgment about how best to help them and how to be objective. And this, again, this whole project is just a dissolution of objectivity. And no one's going to stand for it, I don't think, as a patient.
All right, so let me ask you one more, related. And this is a question that troubles me because I don't know the answer in my own field. So for everybody who's here, I'm a social psychologist. I'm not a mental health professional. I'm an academic. I'm a professor. And this is what I am not sure of in my domain, and I'm asking this about your fields. How much of it is that the activists have captured the organizations and institutions, and through things like cancellation attacks and ostracism, have effectively silenced what may be a very large proportion, a large minority, maybe even a majority of people in your fields who are afraid to contest the influence of this for fear of personal consequences. So it's like just not, in academia, DEI is ascendant. It's entering. It's in 10 years. It'll probably be in just about every college and university. That would be my guess. But I really have no idea. This is mostly being imposed from the top down by administrators installing DEI bureaucracies. But I have no idea. I have literally no idea how much genuine support there is among the faculty. And so I'm turning that question to you. In your fields and your professions, how much of this is intimidation by activists versus the field really has a consensus that this is the right way to do things?
No, I think you're spot on, Lee, about definitely I can say within the field of social work that there are a lot of activist-minded or oriented, whether they're doing actual activist work, but they have activist minds, and they are, basically steering the ship. Specifically, though, within trans medicine or trans healthcare, trans social care, which is more my field, definitely the activists have assumed positions of control and power and are exerting them intentionally, because it has to do with the flipping the power dynamics. These other people were in charge. Those cisgender heterosexual people were in charge of things for long enough. It's our turn now. I don't see it working out so well, because they're not just making those cisgender heterosexual people their targets. They're coming after their own community members, like myself and a lot of my colleagues and my community members. They're coming after us because we're not following suit. And so I think that's exactly what's happened. The activists are in charge. You see that on social media as well.
I would love, I've been saying this forever, for someone to do a survey of people in the field. That's one thing. And the other thing I can say is that, to the extent that we're all beleaguered, we're not physicists. We can put out a shingle and start a private practice and kind of be insulated until the rest of the folks ruin the whole reputation of the field and no one wants to see us. But when you're an academic, that's, especially if you're an experimental person, you can't do that. So we have that latitude, which is great. And those are the people, I've been involved as everyone else has in a few other groups. And who are the people willing to give their names? It's the ones who are in private practice.
Yeah, I wanted to just quickly mention that I don't want to give the impression that I don't believe in advocacy and activism. I think these are important ways to move things forward. My goal personally is to be more of a consensus-based activist or organizers than a conflict-based, right? And so I want to be able to come to the table with a lot of different people. I want to build bridges. I don't want to destruct and tear down things, right? So there's a big difference between those two. I'm sure Valerie could talk more eloquently on those distinctions because she's written about them quite a bit. So it's, I do activism and advocacy work, but I'm doing it in a way that isn't demoralizing and dehumanizing.
If I could suggest there, so I wrote a recent article at my website, ValerieTarico.com, and I'm about the takedown, the woke takedown of a very effective, powerful Planned Parenthood CEO. And the reason I'm mentioning this is at the bottom of that article, there is a list of a bunch of different approaches, links to people who have taken a very different approach, more of the kind of approach that Zander just mentioned, to activism. So even in that arena, it doesn't have to be this kind of competitive cancel culture takedown sort of dynamic, or pigeonholing people into little boxes rather than centering on our shared humanity. There was an interesting article a friend just shared with me by, I'm going to get his name, I'm going to pronounce it wrong, but Nassim Taleb, is that, the author of The Black Swan. In 2016, he wrote an article called The Most Intolerant Wins, the Dictatorship of a Small Minority. And it's a fascinating look at how when you have an intransigent minority, they can have disproportionate power when other people don't have have a stance that is absolutely as inflexible as theirs. But I also think that just reading that gives you some ideas maybe of what it would take for us to stand clear and strong against some of these trend lines.
It sounds to me, can I ask a question?
Yeah.
It sounds to me a little bit like you're dealing collectively almost with a group of people who have narcissistic personality disorder. In other words, a narcissist in any collective setting exerts extraordinary power in that organization because no one wants to deal with them, and everybody sort of folds in their midst. Is that you're all mental health professionals? Is that an apt way of describing what we're dealing with, sort of on a collective level? Maybe I'll go to you, Valerie, since you talked.
So that was a bold move, David. Kind of analogizing it to a personality disorder with a lineup of psychotherapists. But I don't. The question of kind of, is it sort of analogous to a collective form of narcissism? That doesn't quite fit for me. But what does fit is the idea of like kind of shutting out other perspectives and other vantages, almost more to me like the kind of religious fundamentalism that I grew up in. I grew up in evangelical Christianity, and the structure of how taboos work, the idea of insiders and outsiders, the idea that there are these inborn sins, being born white with male genitalia, that you can in no way cleanse yourself of, that you simply have to kind of engage in this process of humility and penance. That all of this stuff, I think, offers a better explanation. I feel like it's not, and I guess the narcissism analogy kind of speaks to individuals, where I really feel like this is what I would call a sociopathology. It's not an individual kind of something I'm wrong. It's a collective.
Yep.
So let me step in here with another quote. This is not exactly in my area of expertise, but I kind of superficially knew that collective narcissism is a sort of subtopic within psychology. So I quickly went on to Google Scholar and found this review. So this is the current directions in psych science. This is a major review outlet. And I'm just going to read a couple of excerpts from the abstract, which I think will suggest that David may be onto something. Okay, collective narcissism is a belief that one's own group, the in-group, is exceptional, but not sufficiently recognized by others, which kind of sounds like wokeness to me to some degree. It is the form of in-group love robustly associated with out-group hate. It predicts prejudice, retaliatory intergroup aggression, and rejoicing in the suffering of other people. It arises when traditional group-based hierarchies are challenged and empowers extremists as well as populist politicians. So it sounds like there may be a there to me.
Yeah, it's just a description. It doesn't explain much.
Yeah.
So,
Well,
I don't know. I'm not a fan
of
that kind of.
Yeah.
I think Valerie's explanation was a little more richer. I think. But.
Well, I think that's what I mean when I refer to the orthodoxy, right? That it is there is there's some sort of book that people are reading out of, and there's things that they're saying or that they're repeating back as somebody else is saying it. I think there have been some articles written about this notion of church of the woke, or the woke church, or is woke the new religion? So a lot of people have been writing on this topic. I shared a link in our private chat because I don't have access to the comments section that could be shared out to other people. I'll
get that for you. Yep.
Thanks, Jen. Yeah, because people might be interested to see, because in this article, they go into like the evangelism and the Puritanism, and they really go into detail about that. And so I find that really interesting, being able to use that framework to talk about what's happening. But I'm not a big fan of I think the idea of personality disorders gets it's a bit pop psychology at this point. Everybody was calling Trump a narcissist, and so I think that gets thrown out there a lot. And I think that most people have traits of personality disorders, but I think that this is more of a sociological, this is more of a societal thing that we're seeing because it's impacting the masses.
Before I want to get one, we've got one question from our friend Joe Nalvin. Do psychiatrists listen to these various ideologies or simply prescribe looking at behavioral indicators for any of you guys?
Well, I guess I should ask the psychiatrists, but I'm sure you guys have a lot to say about that too, because we share a lot of the same strategies, clearly. It depends why someone's coming to see you. If it's kind of a psychodynamically oriented therapy, then you would focus more on, historical patterns that people have, and maybe even focus on unconscious processes. And then if someone comes for cognitive behavioral, it's, you want to know something certainly about their life, because everything has to be in context, but you might focus more on behaviors, with the kind of overarching question of why are you sabotaging yourself? You say you want X, but everything you just told me you did and yesterday, is going to get you farther away from your goal. And let's think about this and dissect this. Obviously, there's some psychology involved, but it's not as it's not as depth. So it depends on the. I'd say it depends on the kind of question the person has, and also on what you agree with. There's a little cynical, I know, but there's a sort of a joke. The reason why, let's say, psychoanalysis works for some people is both the therapist and the patient have bought into that as the strategy. But there has to be an agreement that you think that you both agree that the various style a therapist is going to use, and often they're amalgam anyway of many styles, is the one that the patient thinks will work best, or you try it for a while and see. Anyway, it's hard to have a flat out rule. I hope you guys agree with me.
Yeah, I don't know how recent this research is, but I know that, not that long ago, I remember reading some research showing that it almost doesn't matter what intervention model is being used, that it's the rapport between the clinician and their client that matters the most. So it really doesn't matter, what your theoretical orientation is, what kind of intervention you're using, right? As a social worker, I think we have different lenses, right? So there are different lenses that we're taught about in our training programs. And so, as a social worker, we're more based on the social care aspect of the patient, social determinants of health, how trauma has impacted their ability to function in their everyday life. But they might also then go see a psychologist or a psychiatrist. Right. I think we're very complementary in the types of services that we provide. And a lot of clients are seeing all of us, not us three, but our different professions, because we're in different settings. A lot of social workers are in medical settings, and and in child welfare settings and aging, programs. So it's, it's just it's a different way to look at people. So we don't do prescribing. So, but behavioral is in a lot of ways, I would say, can often be a symptom of whatever it has happened to them in their life, right? The trauma-informed, inquirer would say, not what did you do, but what happened to you, right? To get underneath the behaviors, that might be just maladaptive coping mechanisms to the environment that they were growing up in.
Lee, we've got about 5 minutes. I leave the last question to you.
Well, so this, I don't know if we could do this in 5 minutes, but I'll throw it out there anyway. So the issue is, so my question is, what do you think can and should be done? I mean, to some extent, this whole conversation is just whining and moaning. The world has moved on. We've all been left behind. Get over it, right? That's one view. Another view is that well, no, this is the 21st century version of the British are coming. So, the guy who runs around singing the British are coming has not raised an army, is not defending against the British, is not winning the Revolutionary War, but you've got to warn about something before people will be galvanized to do something about it. But still raises the question of what's to be done.
I think at some point in the future, this woke kind of critical justice informed activist approach to psychotherapy will become one of the different kinds of approaches like Zander was talking about. And that right now, perhaps one of the best things we can do while it's all very muddy is to do what we can to ensure that the public knows that there are different approaches, that this is one of them, that they have options.
Maybe that's the most optimistic, is just sort of wall it off. I kind of, in the informing of people, it'd be kind of nice to know if one of the Consumer Report statements was warning you will not be encouraged to use introspection to find out, to understand how X, Y, Z. But I think what we can do is just talk about this as much as possible. It's still kind of hidden. I mean, I don't think most people know this kind of thing goes on, and I think people should sue. I'm sorry, it sounds so aggressive. Two of you are much more pacifist, it seems, but I mean, I do know someone who is suing their university program for basically malpractice, for not teaching good therapeutic technique. Good for her. And so I'm in favor of that. And for a patient who, visited one of these guys, or, and again, some of their testimonies are on Critical Therapy Antidote, they should sue, because they've also been, it's not educational malpractice, it's literal malpractice. That's not the only solution, but I'm in the corner of the more, aggressive approaches here, but we have to use many.
Well, I mean, that's why, those of us who are licensed, we're licensed by the state to protect our consumers, right? So if a therapist is, practicing outside of their scope, or if they're interfering with the client's or a patient's ability to move through their own circumstances in their own way, with the assistance of their therapist, they can always also report them to their licensing board within their state. I'd say another couple of things. One, and Sally mentioned this, we're creating alternatives, right? There are alternatives for professional associations. In particular, there's the Gender Exploratory Therapy Association. So these are people this is a worldwide organization. It's brand new. They're just getting started. They're going to be building a directory. So for people who want, for their children, for their teens, for themselves, if they're adults, to go work with somebody who's using an exploratory form of gender affirmation therapy. There's also, I'm working with another social worker who's still on those boards, and we're getting a group of heterodox social workers together, and we're putting together a textbook, and we hope to be getting it published this year or next year, and maybe the schools will take it on. So that's what we can do, is we can contribute to our own scholarship, and we can create our own organizations. We can get involved as leaders in other organizations and try and, interject more heterodox points of views, and see if we can move the the sort of the what do they call those? The organizations have been legacy organizations. If we can move them a little bit more back to the center by also creating our own organizations where we can do good work and keep moving things forward that way too.
And I think the concern though is, and Zander, you brought this up, is it's more than just the organizations. And I like your approach. It's how things are now being taught, right? So it's becoming normalized where that, so Sally had the idea of walling people off, which I like, but at some point, will we have a generation where this is the normal therapeutical practice? And that's perhaps a conversation for another live stream.
Yeah, because there's different levels. There's the education in the classroom. There's our field education, our internships, right? So there's all these different levels at which we have to pass through, and get graded and in order to graduate and go on and be professionals. And so if they start implementing all of these like DEI kinds of things that we need to jump through based on their interpretation of things, it's like, how do you push back on an accrediting organization? Like, that's a big organization to come up against. Yeah.
So perhaps we'll end now. Thank you to all the panelists for a fascinating discussion and a very informative discussion. Thank you, Lee, for moderating and bringing your vantage point as a social psychologist to the discussion as well. We at the Institute for Liberal Values are very concerned about how this plays out in institutions. Even if the political winds shift, and they may, this ideology is insinuating itself into institutions. So we're going to be doing an ongoing set of discussions around how critical social justice ideology plays out in institutions and what we can do about it. And in the hopes of raising awareness of how damaging this ideology actually is. We're going to be looking at literature, for example, in the future. So please follow us at IL Values on Twitter. Check out our website, ilvalues.org, and stay in close touch and let us know your ideas for how we can continue to raise awareness of the change in our institutional life and what we can do to push back against it. Thank you very much.
Bye, everybody.
Have a good day, everybody.
Bye. Thank you.